Hi, my name is Terry Kuti. I am the founder and director of Deep Sea Foundation. Welcome to our educational channel where we talk about a number of topics related to breast cancer and breast reconstruction. You know, when a patient is diagnosed with breast cancer, the support system that they have is so very important. I'm very honored today to be joined by my guest who supports patients in this effort. Her name is Mollie Sugarman, and she is the clinical director of the Patient Empowerment Program at NYBRA Plastic Surgery in Great Neck, New York. That stands for New York Breast Reconstruction and Aesthetic Plastic Surgery. In January of 2009, Mollie joined Dr. Ron Israeli and Dr. Randall Feingold, co-founders of the practice, and she created the Patient Empowerment Program. Mollie, welcome to the program, and I'm so excited that you're going to let us know all about this program this morning.
Well, thank you so much, Terry, for that introduction. And I want to take a moment to acknowledge your dedication and extraordinary work through your Deep Sea Foundation. Truly, your commitment to provide education and resources to empower women and men to make an informed decision for breast reconstruction after mastectomy is just extraordinary. And I'm truly honored to talk with you today. So thank you for inviting me.
You're so kind. Thank you, Mollie. I'm so anxious to hear about this program and all it does for breast cancer patients. So please, let's get started and let me know all about it.
Surely. Well, as you unfortunately know, Terry, receiving a diagnosis either of breast cancer or carrying a gene mutation is experienced as if you've been hit by a stun gun. It feels surreal, as if you've been thrown into abyss, not knowing what direction to go in. One doesn't know the language and feels a complete sense of disorientation. And it's absolutely terrifying. At NYBRA Plastic Surgery, our approach is an integrative one that addresses that connection between the physical and emotional well-being of the patient. As you mentioned, along with the practice founders, Drs. Randall Feingold and Dr. Ron Israeli, I created and directed the Patient Empowerment Program, also referred to as PEP, which I love acronyms. Through the 13 years of this program, we have observed that addressing the emotional components is an integral part of the healing process. It's exceeded any of our expectations. My relationship with our patients begins at the time of consultation when the various aspects of the program are reviewed and the needs of the patient are assessed. This is the beginning of my relationship with the patient for their journey. The tools through PEP serve to empower and to offer a sense of control to our patients. If you think about it, patients come to us at a time when they feel most vulnerable. They don't realize that at that point, how resilient they are. One goal of PEP is to take our patients from that feeling of vulnerability to a feeling of being victorious. Patients work with me directly, and they're also linked with other patients through various components of the program. It facilitates that tapping in to that sense of resiliency. The community bond and tools we provide enable patients truly to connect to that inner strength and tenacity. The program also benefits both the patient and the caretaker or the partner. While the description of the surgical procedures by our esteemed physicians are truly critical and an extremely valuable part of the process, the program experience provides a different perspective and level of understanding when it's shared by veteran patients to patients first beginning the process. The connection to patients having the same reconstruction and the same medical team truly fosters a sense of community that endures way beyond the point of physical restoration. It is not unusual, for example, in my sisterhood of support groups or my men's breakfast meetings, for individuals to be newbies who are first starting the process, to those who may be a week out, 6 weeks out, 4 years out, 12 years out. And I must say that this is both invaluable and inspiring to the new patient. The community of patients really instills a feeling that the new patient is not alone and that they will be supported along the way. It further allows our patients to see the magnitude of the impact of this innovative integrative approach. And in many cases, Terry, it broadens patients' perspective on how they'll manage stress as they move forward. We've also observed its influence on the mindset and sensitivity of our staff in the practice and how it feeds the team approach. The end result is that the patient feels supported by the entire team with whom they are partnering for this whole difficult and challenging journey, from the person who greets them at the front desk to the person who's scheduling, to the shared decision-making approach with our doctors regarding reconstruction and beyond. Because of my more intimate relationship established with our patients, I frequently also am able to provide our physicians with a greater understanding of other stressors in our patients' lives, which then enables another layer of sensitivity.
Absolutely.
And it's critical for our patients.
Yeah.
Another significant piece is assisting the partner in knowing how to best be available to the patient, to provide support for their own anxiety, for their sadness, for their trauma going through this. And partners, I truly feel, are the forgotten parties in this whole process. You know, there is no book to which they can refer. And I'd like to give you a little anecdote. One of the things that the program helps with, because it helps the patient and the partner, and they can make changes individually, it then impacts how the couple responds to the trauma.
Yes.
And to a greater extent, the family around them. But I'd like to give you a little anecdote. My tendency is to go into the various exam rooms when patients come in for follow-up. And about 12 years ago, I went into a room with a patient who was there for her pre-op exam. And I took a look at her husband's expression. And this was the second time that I was meeting him. And his expression was one of devastation. She had been diagnosed with a very aggressive and advanced form of cancer. And I looked at him and said, "How are you? How are you?" And he stepped back with surprise and said, "You're the first person to ask me that."
Wow.
And we have been from this consult to that consult, and every single time the provider has looked at my wife, has had no contact with me, and when they're ready to exit the room, just kind of punches me in the shoulder and says, "Be strong." And he looked at me and said, "What is that supposed to mean?" Well, he became engaged in the men's breakfast meetings for 6 years. Every month he was there, and in between he was connected to the other men who really embraced him. Very sadly, his wife passed. One of the things that was most poignant at the funeral was that every single male who had been part of his men's breakfast meeting was there to support him at the funeral. And
that's his legacy wow, that's so powerful, Mollie.
Yes, and this, we're talking about a significant amount of time, and that connection, that very deep connection, which is unusual for men in particular. And I'm not being critical, but I just in general, it's easier for women. But that connection in that group is extraordinary, and it's lasting. It endures. They still have contact with one another. They're concerned about each other, and they reach out to one another. So that's
the fact that you said, Mollie, this is a very strong statement to me that you made. The fact that you asked how he was doing rather than say to him, he's strong. That is a totally different way of acknowledging the caregiver and opening up how they're feeling.
yes, and because I visit the exam rooms every time they come, that relationship builds and a sense of trust builds and a commitment to the program and to take advantage of the tools is something that then becomes very, very strong. The other thing, Terry, that I think is very critical, and I feel very strongly about this, is that I have the great fortune from the support of the partners in the practice to have this be an open-ended program.
Yeah.
And I think that's important for many reasons, one of which is that loss and grieving are not done in any time frame or any order. And when someone is newly diagnosed, they robotically go from this consult to that consult to this diagnostic. And sometimes that the only way that they can do that is to keep the emotional component at bay.
Yeah.
So that it's not unusual that once someone is through the physical restoration, that the emotional components will start to come to the forefront. And there's great comfort in our patients knowing that you can come home again. And they feel a sense of safety knowing that this is there for them.
What you've done, Mollie, I'm a strong believer in creating community. And we both are doing this in the breast cancer space, which is so important. What you've done is create a sense of community. And you've created a circular community where you're starting with the patient, but you're involving the entire team. You're involving the caregiver, the surgeon, yourself, the staff, everyone in that. Sometimes I like to call it a tribe that surrounds this patient with your keyword, empowerment, even in the face of a breast cancer diagnosis. You know what I'd like to do, Mollie?
What's that?
We have a lot to talk about on this topic. How about you and I follow this up with a podcast so we can take a deeper dive and talk more about how important this support is?
I would love to. Thank you for that invitation. I think the critical piece is to emphasize to people that they can reclaim life after cancer. And certainly through the work you do and through this program, I would be most happy to continue this discussion with you.
I would love that. And I'm sending you out an invitation for that. Okay. I want to thank you for this information today. This is so important for patients, I think, to ask if this is provided. I am very grateful for your time and program that you have provided at NYBRA with your surgeons, but most importantly, for your patients, Mollie. So thank you so much for being on the Foundation Educational Channel today.
Thank you, Terry, for having me. I really appreciate it.
And it has been fun, and I look forward to that podcast. We'll see you soon. Thanks so much, Mollie.
All right. Bye-bye.